Kaye and Nurse Inez Kaye. Now this program well Bodi na gently. Mr. Coco
Good afternoon, good morning, good evening, me fambul them. Una welcome to another program of Well Bodi na Gentry. Today, we dey discuss about heart disease part 2 and how you go live with them. Last episode, I been talk about my experience where I been get heart attack. Dr. Soare been talk to we and explain how heart attack they happen, wetin they contribute to heart attack, and how we can take care of ourselves if we get heart attack. And what we go do for decrease we chance for get heart attack? Well, today we get two of the master sabi people them from we motherland Mama Salone. Dr. Soare are eager for land today, so they are telling more about them people there.
Good afternoon, good evening, my family. And I thank you for when I join me. Miss Inez, today we get two experts there, two master savvy people there, when I heart specialists there, where they can talk to we more about heart disease. So today we get Dr. Naddi Marah, when a heart specialist where is specialized for the deal with people that will get them blockage in their hearts. It did in USA, so it joined with today. And also we get Dr. Christine Williams, when a heart specialist within a Bodi Salone, where INSEF they come for can join in at the head of medicine at Joy Hospital. They get training in heart, heart problem there. So the all together can talk to we more about the complication there of heart problem there and what we can do for treat their heart problem then they. And the things that we go able for do, how we go change with lifestyle and for make sure say we live long, even if somebody get heart problem. So, I'm so glad that we get them people here so for can talk to we today. So we'll go right ahead and start with Dr. Christine Williams. So Dr. Williams, the last time at the show, we'll talk about where if somebody they get symptom of heart attack, when like chest pain, they get trouble for breathe, then symptom and the way na heart attack symptom then, how important for me that person they go na hospital right away. If you get aspirin, may it take aspirin and then may it go na hospital right away for me it go get treatment. Because we don't say about who people and they're not too aware about the heart attack symptom then. So I want for me you tell me from the patients the way you they see na hospital and na salon, what symptom the way them people and they come with na hospital.
Good evening, Dr. Soare. Can you hear me?
Yes.
Good evening, me family. I know they do how everybody they do. Thank you for having me. Now, privilege for can talk to with salon people then, but this one great big sickness salon in a heart disease. For be fair with you, Dr. Soare, the kind of symptoms the way they get is not classical because the one way me can get mostly na unstable and stable angina type of symptoms. They will kind of tell you, say, doctor, where I exercise small, me chest they tight for me heart they beat fast, but where I low, it better. So the acute coronary syndrome we get the unstable and then the MI. The MI and get the STEMI and the non-STEMI. So for make we see patients where they come with acute coronary syndrome, it's not easy because most of the patients then they not even know saying a heart attack they can get. Because then they feel say na chest bone. Most of the patients that when they get them problem, they go to drugstore or then go to pharmacy, go buy new gel. And for make I tell patients now, I say when you get heart problem, take aspirin and go to hospital. That's very uncomfortable because most of them get comorbidity. They either get gastritis or they get ulcer. So just the symptoms. And because of, I don't know if not the cost or not the distance, where they can get them symptoms, then they go hospital. Then they go and take new gel. So where do they get now? Now more of subacute MI, or we get old MI that we present now hospital, or the first one we talk, that stable angina type of symptoms. Or they carry complication, the classic one, a heart failure. Can the foot, they all get pity, we go inside, bojo. Then they say, we say, I don't tell me, heart's a bit fast. So now the type then we get na salon.
Thank you so much, Dr. Williams. And a very interesting point and big difference from where you did in the Western country there in terms of waiting for do. So from where you did salon, if you get then chest pain, where you walk quick, you don't feel like say you tired, your foot then they swell, all that they can be complication of heart problem where you need for go now hospital for me you go get treatment, med and check out and see what's in the go on. Also for just go na pharmacy, go buy new gel or begin the treat, or if you say na heartburn na you get. Dr. Marah, so you the practice na America now. So tell me which symptom the way you can see and then patients they can come with, how we compare with waiting Dr. Williams can see in a salon.
First off, thank you very much, Dr. Swari, Dr. Williams, and Mrs. Inez. Hello, everyone. My name is Dr. Marah. As mentioned earlier, they specialize in the treatment of heart disease, including heart attack and heart valve replacement procedures. We practice based mainly in Houston, Texas. It's an absolute pleasure to be part of today's panel, and I look forward to a very informative discussion about heart disease. Dr. Williams touched on very, very key points about how people present with heart disease in a salon. Believe it or not, they have pretty similar presentation in the US, in the Western world, okay? Now, unfortunately, heart disease continues to be the number one cause of mortality and morbidity across the world. America, in the Western world, and in the non-Western countries. It's ahead of cancer, it's ahead of stroke. Even though COVID may happen in America also, heart disease may still happen because maybe they work 24/7 despite COVID, okay? Now, heart disease also, unfortunately, has a very wide spectrum of presentation. And it varies. It's based on your age, it's based on your gender, and like Dr. Williams say, also based on the underlying medical conditions and other medical conditions that we get. Surprisingly, but people are not can get symptoms. Then they work out heart disease every day, they don't know, then get no symptoms. The people are older, above 65, people will get diabetes, and women sometimes can come with very, very unusual symptoms, unusual presentation. They can be just tired, they can weak, they can get discomfort in their belly, they can get reflux, like what Dr. Williams mentioned, they can things, and they're very atypical. When in reality, then they get full-blown heart attack, they don't know, A small percentage of people actually get a classic combination of the chest pain, the chest pressure, the chest tightness, what can happen with activity. For example, then go up and down stairs, then they walk around in a motor car, then they come up from work, or then they exercise. Sometimes then symptoms can count with emotional stress. If then they argue, then they holler, then they sing, then they dance, then kind of things, and they can relieve that chest pain. They can relieve either with rest or you then take certain medicine. And that's the classic presentation of chest pain. So the problem is because it goes unrecognized, even here in the US, it can lead to a delay in treatments and it can lead to potential complications. Okay. The number one complication, another heart attack. The second complication, weakness in the heart muscle, what we call heart failure or pump failure. And with this, when the heart they pump, you need to move blood forward to keep up with your body in demands. And as a consequence, you can get things like shortness of breath, you can lose your ability for exercise, your ability for they don't flatten a bed without having to use several pillows for breathe better. You can get like fluid retention at your leg, like what Dr. Williams said, leg swelling. You can get fluid retention at your belly. Now, so it can look, you know, another thing that can happen, for example, where you get delayed presentation of heart attack, you can get electrical issues. Electrical system of the heart itself can go bad. Your heart either beats fast, sometimes it can beat slow, sometimes it can just stop for a bit all of a sudden. Okay. Another thing what can happen is stroke. Believe it or not, when you get heart attack, you get complications. Stroke is something else that could happen. And stroke can cause, now when you get lack of blood flow to your brain pipes them, okay, the pipes of the supply the brain. And then it can make you lose muscle function. You can get weakness of your arm, your leg. So it's like you lost sensation. Your face can droop. You know, get for talk, you know, get for swallow, any kind of things. And the last dreaded complication are now how the heart attack itself can affect your heart valves them. You know, we hearts then get 4 major valves. The 2 most important valves then on the left side, that then they allow blood flow for come up from your lungs, for exit the heart, for go supply all your vital organs them. When you get heart attack, because the muscle is weak, it affects the way them valves and they work. And as a consequence, you get valve failure, which means it can require additional procedures for fix your heart valves. So it's similar, you know, as the way it presents with people already back home in a salon, but the complications could be very dire.
So this is a very interesting way to, Dr. Williams and Dr. Marah, you don't tell me is heart problem, then Boku people, they know they recognize, you know, early, they know they recognize the symptom early, and Boku 10 the people, then the way that they go now hospital now, they don't already, they get complication there. Either they don't get the first heart attack, they don't even recognize that, and maybe the later one, then that chest pain, the way still they go on, where you say, where you do small thing, you begin, your chest, they get pressure or tightness, or they get trouble for breathe, or they begin get the pump, the heart pump, not they work so well now, then they begin, they build water, then leg, then they swell, more than they now, they see that they happen, or somebody just die, it just drop dead. Because, you know, the heart electricity, not they work well because because of the heart attack with the person we don't get. So, Miss Inez Imbi gets heart attack, and it tell we in story, which was amazing because now be young person and fortunate to be recognize some of them symptoms, then they and go, for go get treatment. So. And Dr. Ma, so you begin touch on a little bit, but waiting at some of them treatments then where somebody where don't get heart attack or somebody where recognize say they get heart attack, waiting at some of them treatment then if you go to hospital now, waiting that they go do for you in hospital.
Well, and I sure see the treatments, different small for me also as compared to how Dr. Williamson did manage them patients in a salon. Fortunately, we've been blessed to have access to a lot of things here in the US for treat patients them very, very quickly. About 1 in 10 people with heart attack, who means blockage of the blood supply, obviously, to the heart muscle itself, then they die before they even get treatment. 1 in 10 people, they die before they get treatment. Okay, and that stems from, like we mentioned earlier, lack of awareness. They say, oh, they send us on tears, they happen, there's a heartburn, delay presentation. Okay. We work tirelessly for decrease this number. And this they begin with prevention, first of all. Okay. It's very important. I always tell my patients and say, and I want to see in hospital. 1, the food not good. The TV remote control they ever work, right? They always complain. The room temperature, ever regulated like you want on your own house, right? The bed uncomfortable, and they get a worst sleep in the hospital. So what I can say to my clinic, I say, listen, if you take your medicine and no prevents you from getting a heart attack, you got to avoid all the different things in there, okay? But unfortunately, it's not enough to keep them out, okay? What heart attack happened, it happened, right? You get for one hospital. Now, we in kind of hospital with heart attack, we get for work very fast, we get for be very focused, very decisive, because every minute counts, okay? As every second goes by, the heart not get blood flow, enough oxygen, the heart muscle, they die. And those complications I mentioned earlier, they start piling up, okay? Now, there are several medications that we use, for treat heart disease. And cardiology, as you know, is heavily evidence-based, which means, say, several decades of research don't happen for tell you which medicine better pass the other one, pass the other one, pass the other one, for compare and contrast. For make sure, say, whatever we use for treat with patients then comes from very good, strong decisions and research, okay? Now, depending on the presentation, we get several different, what we call algorithms, step-by-step pathways for see if we dey carry go, rush you go to the operating room, versus we dey carry go to the hospital ward, stabilize you first, give you medicine them, do some other testing before we determine what's not the best treatment plan for you. That's pretty much what we do, okay? Now, we can either treat you with medications or we treat you with medications plus a procedure, all right? And with either treatment, like I say, we get for make sure say that the best option for you based on your age, your gender, your comorbidities when you present, and what else they go on. Now, make I just briefly discuss the difference. Different group of medications so they use include things like blood thinners, such as aspirin, okay? And with the Gidani for prevents the arteries or pipes from clogging with cholesterol and for allow blood flow to the heart muscle incisive. Now, we use another set of medications then we call beta blockers. The medicine and then they slow down the heart rates and they help for relieve the stress on the heart muscle incisive. When they get heart attack, your heart they beat fast, they beat fast, they beat fast, they beat fast. And one thing it cause you heart for require more oxygen, more blood supply, and it's like a vicious cycle. So for kind of prevents that day, we the one for slow your heart rates down. So we give this medicine called beta blocker. So first aspirin.
If you get question then, una can send to question then on our Facebook page, on Twitter, on Instagram, or even email we na wellbodysalone@gmail.com. Again, this is Dr. Mafudia. Thank you for waiting to watch the video. Stay tuned for our next video.